On PrimeTime Politics tonight, the vaccine confusion intensifies. The Prime Minister urges Canadians to get a shot as soon as possible, even after the National Advisory Committee on Immunization cautions against taking the Johnson & Janssen or AstraZeneca vaccines. We'll get some advice from an expert on vaccine hesitancy, and MPs will debate the latest developments. And a Conservative motion calling for the firing of the Prime Minister's Chief of Staff over the handling of the Vance allegations is doomed to fail. So where does that leave the search for more accountability? But we will begin tonight with the continuing fallout over vaccine safety. The Prime Minister and Health Canada officials were busy today trying to reassure Canadians about the safety of all vaccines approved for use in Canada. That comes on the heels of the latest advice from Canada's Advisory Committee of Vaccine Experts that has resulted in reactions ranging from bewilderment to condemnation. NACI experts have suggested anyone who thinks they're at lesser risk from COVID might want to opt for the Pfizer or Moderna vaccine instead of the Johnson & Janssen or AstraZeneca vaccines because of extremely rare cases of blood clots. That contradicts the months of advice from Health Canada to take the first vaccine available. Today, the Prime Minister and the country's Chief Public Health Officer were again telling Canadians to get the first vaccine shot they can.
Every single vaccine administered in Canada has been judged by Health Canada as being safe and effective. The impacts of catching COVID are far greater and far deadlier, as we've seen across the country, than potential side effects, which, although serious, are rare.
If you're asked to take your turn, please do so and line up. I think that's the bottom line.
Well, let's follow up now on the confusion or contradiction of the overall messaging on vaccines. I'm joined by three members of Parliament. Steve MacKinnon is the Parliamentary Secretary to the Minister of Procurement, who's responsible for the vaccine supply in this country. Eric Duncan is the Question Period Coordinator for the official opposition Conservatives, and Don Davies is the health critic for the NDP. Good to see you all, gentlemen. Thanks for being here.
Good evening.
Steve MacKinnon, let me start with you. The Prime Minister did his best today to set aside any concerns Canadians might have over vaccine safety by saying he has no regrets for taking the AstraZeneca vaccine. Full disclosure, I have had it myself. But the Prime Minister telling Canadians, look, get vaccinated as soon as you can. But the fact is the panel of expert advisors is telling Canadians AstraZeneca and Johnson & Janssen, not the preferred vaccines, and that some Canadians shouldn't rush to get them. Why isn't there a uniform message coming from the Government of Canada and the experts on vaccines?
Well, there is a uniform message coming from the Government of Canada, and that is that the portfolio of vaccines that we've assembled is safe, it is effective. That has been confirmed by real-world clinical trials and then, of course, real-world application. And if you've had it, Peter, and the Prime Minister have had it, that makes three of us, because I also have taken the AstraZeneca vaccine and was very grateful to have gotten it. The fact is that we know that these vaccines show us the end of this pandemic. We know that where they have been, where we have been inoculating millions of people, that they have been setting this disease back. And that is what we want. That's what we're going to continue to do. And we will do that with all of the vaccines available to us, all of which, again, have been judged as safe and effective.
Mr. Duncan, if there is a communication problem, how do you fix it?
Well, good question, Peter. And even I'm finding a lot of frustration. I think this is leading some Canadians to have vaccine hesitancy whenever they have the panel come out in the morning, and then in the afternoon, the Prime Minister and others and the Health Minister are saying different things. A few days ago, it was take the first vaccine that's offered to you. Now we hear in the second answer and question period today, the Health Minister say, well, check with your physician. I can't wait to get my vaccine. I know, and it's great seeing the photos of more people in my riding and region getting them as well, but it's very frustrating to see. There needs to be one clear, consistent message from Health Canada, from the leadership of this country about what to do, and not coming out contradicting, creating confusion, clarifying later that day. And Peter, this is not the first time it's happened either. I keep saying you learn from your mistakes, and I feel like time and time again when it comes to this, we're repeating the same mistakes over again of not having the federal government give a clear direction and leadership on this.
Mr. Davies, how big of a problem is this messaging on vaccines? And if it is a problem, what does the government do to fix it?
Well, it's certainly a problem. I'm hoping it's not a huge problem. And And, this isn't the first time. I mean, of course, I'm on the health committee, and so we've had NACI appear before us on a number of occasions. And quite honestly, about a month ago, they had very confusing messaging on AstraZeneca. In fact, they changed their position 3 times in the space of 14 days, and that's not helpful. I will grant this to Steve. I think the government has been consistent in their messaging. I mean, their message hasn't changed, which is take any vaccine that comes to you and they're all safe. And I think that's true. What is confusing, though, is when the NACI, upon whose expertise they rely, when they give contradictory, changing, and confusing messaging, right. That is a problem. And I don't think the government can have it both ways. They often will tell us, rely on the experts, listen to the science, don't second guess their judgment. But I think Canadians are legitimately confused right now when the national group that's advising on immunization is changing their position and giving contradictory information from that of the government.
There's a lot of experts on this across the country, and a lot of them appear on this channel and other channels on an ongoing basis. And largely the messaging is the same, but there are sometimes different messages. And Mr. MacKinnon, I guess I'm wondering, is this competing advice on vaccines, or at least differences of opinion on what vaccine to take, is it necessarily a bad thing, or is this the result of bringing lots of advice, contradictory as it sometimes might be, to the table and promising a transparent vaccine process?
Well, again, I'm going to belabor this point for a moment. The fact is that these vaccines are safe and they're effective. We see in the UK, which has virtually relied solely on the AstraZeneca vaccine, we see the results it's having there. We see the results that other vaccines are having in other jurisdictions. So we have the best possible evidence, because it's right before our eyes, that these vaccines show us the way out of this pandemic. They keep you from getting sick. They keep you from going to the hospital, and they should be taken just as quickly.
Right, but I guess what I'm asking is this what you get if you want an open process? You're going to have some experts saying, Indeed. You know what, there's a different way to do this. The alternative is to say, NACI, thanks for your time. We don't need your help anymore. We've got a communication policy here. Stand down.
Well, we're imposing a rigor on these processes, which are all, of course, unfolding before our eyes. With the miracle of modern science that is immunization, that is vaccine, is of course, an evolving one, because we are getting real-world, real-time data every day being put through the filter of the entire world's media. And that's being interpreted, as you say, Peter, by dozens and dozens and dozens of experts. So at any given time, of course, you are going to have someone saying, someone offering an interpretation that may be a shade different than the other. The important thing is, I do want to stress this, because this is very important. Okay. People watching this channel take these things very seriously. The Canadian regulator, Health Canada, which is among the world's finest regulators of vaccines and pharmaceuticals, has ruled that these vaccines are safe and effective, and you should take the first one that's offered to you.
All right, Mr. Duncan, do you think we need NACI? Do you think we need experts that at times may have a different point of view on the safety of a vaccine, or the application of a vaccine that's different than others at Health Canada?
We need a clear communications plan, Peter. That's what we need. And I'm going to say on
But to get that clear communications plan, do you tell the NACI people, we don't need your advice? I mean, they're going to speak out. That's their job.
Well, there should be, but again, in different organizations, you have how the information's filtered and what is said and communicated on this. And again, I'll take the line here. I think all three of us and our respective parties want people to take the vaccine. We want to get past COVID like everybody does. But what this does is contribute to the chaos and the confusion. We've seen this before. So there needs to be one voice on the issue, speaking to Canadians about vaccine safety and the recommendations, period. Not having to come out one morning a recommendation, and the government says, listen to the scientists. This is a panel of scientists and experts come out and says something, and the government says, well, don't really listen, or talk to your doctor, and it creates confusion.
Okay, but I'm still not clear. Would you shut down the NACI folks? Would you tell those experts, no more news conferences, no more giving your opinion, leave that to Health Canada?
Well, I would certainly say, if I were the minister in the department in the Prime Minister's office, I would be meeting with them and saying, look, This is not helping to getting more Canadians' confidence in getting vaccinated. We need to come up with a clear communications approach. One way, one message, one voice. How you get to that at the end of the day, that is inside baseball or internal. But there needs to be a clear message. How that comes, Peter, I think we could take a look at it. We can do better on it for sure.
Okay, Mr. Davies let me jump to Mr. Davies. Is NACI performing a useful function, or is NACI getting in the way?
I think a bit of both. I think they have played an important role. I mean, this is the National Advisory Committee on Immunization. They existed before the COVID crisis.
They're made up of infectious disease experts, pharmacists. They're a broad group of experts that have been, and it's voluntary. They've been called upon to advise the government.
Yeah, and let's face it. I remember about a month ago, you had three different federal appointed bodies. You had the Canada's Chief Science Officer, Dr. Mona Nemer. You had Health Canada, and you had NACI. All say three different things on AstraZeneca in the course of a week. And Dr. Mona Nemer, I thought, hit it on the head when she said, what we're doing in some ways here is we're conducting a population-level clinical trial. And I think that's true to some degree. The truth is that we don't actually know. We don't have hard answers on things, and so we go with the best evidence that we have. I personally think a little bit of diversity of opinion is healthy. Let's face it. It depends on your tolerance level. NACI's pointing out that there are issues with thrombosis with some of these vaccines, and we're not exactly sure what the rate is. Overall, I think there's a consensus that it still is vastly preferable to take the vaccines, considering the relatively rare risk of blood clots. Okay. So that is a message, but I think it's helpful for Canadians to have informed consent, to know that that is a risk. And in a democratic society, sometimes you just have to respect that there's different opinions on things. But definitely, we should have a clearer voice coming from the government, speaking, I think, to Canadians on such an important issue. Right. And we're not hearing that. Thank
you all for weighing on this. Time's short tonight. Thank you all for weighing in on this important conversation. And it's a big decision for a lot of Canadians to have to make, and they're hearing lots of different information. So we'll see how they absorb that. But thank you all for your perspectives tonight. Good to talk to you all. Take care.
Thanks, Peter.
Thank you, Peter.
Dr. Cora Constantinescu is an infectious diseases specialist at the Vaccine Hesitancy Clinic at Alberta's Children's Hospital. She's with me now. Doctor, thanks again for taking time to speak with me today. I appreciate it. Look, you're an expert in vaccine hesitancy, and we've got this NACI advice and the confusion over vaccine safety, competing messages here. Is that making your job a whole lot harder?
Well, it's definitely made it a bit busier over the last few days. But at the end of the day, our job as physicians is to support people as they make the decision to vaccinate. And this is a long journey. And every time recommendations change, and whenever these recommendations are taken out of context and shared broadly on social media and other types of media, it rattles people emotionally. And this is an incredibly emotional decision. So we are seeing more people come forward and doubt their decision. And it also means that we as physicians need to be there for our patients even more than before, to support them, answer their questions, and at the end of the day, validate their decisions. We've been doing it for over a year around COVID, right. And especially now in this terrible third wave, people need us more than ever because they need to be protected more than ever.
So give me a sense of what you're saying to patients who question. What is your message if a patient is considering is being offered either AstraZeneca or Johnson & Janssen when we get it, and they've heard this mixed messaging around the safety issues? What do you say to them?
At the end of the day, this is an incredibly personal decision that every one of us has had to make. So what I always when we talk to patients about this, is I ask them to put in the perspective of their own lives and look at the threat of the disease. If you're in a place like Alberta, for example, or Ontario, we're seeing the threat of disease and death from this disease higher than ever before. And you put that into the context of knowing that you have a vaccine, and whether it's a viral vector vaccine or an mRNA vaccine, they've all been shown to be incredibly, incredibly good at preventing hospitalizations and deaths. And at the end of the day, these vaccines may very well save your life. And then when you look at what we're dealing with right now in places like Alberta, and you look at the fact that in places like the UK, where they've broadly vaccinated with AstraZeneca vaccine, they're planning how to reopen their economy. So it's all about that perspective and what the risk of the disease is to you and what this vaccine means to you.
So as a specialist in this field that's clearly following all the advice and the messaging closely, how do you view it when you see NACI say, look, there are preferred vaccines, a couple of vaccines preferred over others, and you should consider your circumstances for taking it, and then you have Health Canada and the Prime Minister saying, look, take the first vaccine that's offered. They're all safe. They've all been approved. I mean, how do you measure that guidance as someone who then has to consult and advise patients?
Well, it's just like you said it, at the end of the day, the message has kind of always been the same, that said that if we're looking at the threat of this disease, we have vaccines that can save lives. And when that vaccine is available to you, of course it makes sense for you to take it, especially as we're in this third wave. And I view it the same way I always have. At the end of the day, my job is to support people when they make that decision. Like one of my friends called me, and he's a 42-year-old man whose child is isolated at home from a contact with COVID. And he had his AstraZeneca vaccine last week. And he called today almost wanting a validation for that decision. And would his decision have been any different today? I don't think so, because at the end of the day, the threat is here. The threat is closer than ever before, and we have vaccines that can save lives.
Is there, as you follow this along, and it's not the first, we've had this sort of discrepancy over AstraZeneca, now over Johnson and Johnson. What would your advice be on the messaging side if there are legitimate, I guess that's one of the other issues too. Do we want a volunteer panel of experts that weigh in on some of these safety concerns, or would we rather just not hear from them and push ahead? I mean, is there value in having this group of experts, NACI, weigh in, even if sometimes the message is one people don't want to hear?
Absolutely. Every country and every vaccine program needs an independent group of experts who understand the science, who can make recommendations on how to use vaccines to different territories and provinces in our country. And, in some ways, this, I do believe, has been taken out of context and shared broadly. But you look back on their previous decision, which was to give one dose of a vaccine and to increase the time between the first and the second dose. And that decision saved lives. And these guys are working really hard and making really important recommendations and decisions. But as with anything to do with COVID and COVID vaccine, you have to put it all into perspective. And you need to look at the different recommendations. You need to look at vaccine availability. And you need to look, each and every one of us has to make a decision that is right for us. And again, we're in the third wave. The threat is higher than ever before. We have vaccines that can save lives. In some ways, the message has been the same, and it's not changing. It's just that people need more information and more validation on the decision to vaccinate.
All right, Dr. Cora Constantinescu, always great to get your perspective. Thanks again for providing it to us today. Appreciate it.
No problem. And can I just say personally to you, Peter, I know you've had your AstraZeneca shot, and I just want to say thank you. And I want to say thank you because you protected yourself and your family, and you've gotten us all a bit closer to community protection. And I think that's the kind of message that Canadians need to hear.
I don't want to make this about me, but I've had that experience. But I guess what a lot of people who are in my position who've had their first dose, some of them will be wondering, do I still go get a second one now when I'm hearing these different messages? What would you say?
You know, the mixed trials are ongoing right now. So within, I would say in a month, we'll be able to give you some data-driven recommendation. A lot of that will also depend on where the variants are at that time, and also where we're at in terms of vaccine availability. But right now, you've made the best decision that you could make around getting yourself protected. And I know people don't want to make it about themselves, but vaccine champions are important because it's important for Canadians to hear from others who have made this decision, especially as now there is maybe more doubt and concern around it. So I would urge you to actually share that because it's important for people to hear it.
Yeah, I have been sharing it. And well, thanks very much for your perspective again. Always good to talk to you. Take care.
Yeah, thank you for having me. Have a nice day.
Well, the House of Commons spent most of the day today debating a Conservative motion calling on the Prime Minister to fire his Chief of Staff, Katie Telford, over the fact she was aware of the allegations of sexual misconduct against the former Chief of the Defence Staff back in 2018, but did not tell the Prime Minister. But when the motion is voted on Wednesday, it's destined to fail because both the Bloc Québécois and the NDP oppose Telford's firing. But the Prime Minister still faced continuing questions today in the House of Commons on the handling of the allegations against Vance.
Did the Prime Minister himself know about the allegations against General Vance, or is he satisfied with the cover-up conducted by his Chief of Staff?
The Right Honourable Prime Minister.
Mr. Speaker, once again, as a government, we have always taken extremely seriously our responsibility to ensure that survivors who come forward with allegations or experiences of sexual harassment or sexual assault get properly supported. We have seen time and time again over many years that the processes in place have not been strong enough to support them. We made significant investments and improvements in those processes, but there is more to do, and that is what we are focused on as a government by appointing Justice Arbour and General Carignan. We will continue to make sure we are supporting anyone who comes forward with allegations.
Lawyer Michel Drapeau is a former Canadian Forces colonel who specializes in military law, and he has represented former and current military members who have faced sexual misconduct in the forces. He's with me now. Michel Drapeau, thanks for your time today. It's good to see you again. What are your thoughts as you watch the latest developments in the fight over political accountability on the allegations of sexual misconduct against the former Chief of the Defence Staff? Who knew what and who told who? As that plays out, what are you thinking as you watch this?
There is confusion in it, and I think we should be looking over and above just the players at play at the moment, because ultimately it's the security of Canada that is at play. I mean, we trusted somebody with the rank and position of acting as the Chief of Defence Staff, having control over the military establishment, representing Canada in NATO, in NORAD, in all type of international fora, and also to define and to prepare against any threat to Canada. A very significant, unique type of position, and in command of about 100,000 regulars and reserve forces. I mean, I cannot think of a more important, more significant, more crucial position to the defense and security of the country. So how we select this individual and how do we react when something, in fact, touches upon its integrity, its capacity to continue serving in this unique position. And if there are lessons to be learned, and we need to go to the bottom of it to make sure that measures are put into place, that we don't commit the same error again. And what I see at the moment is a sort of a laissez-faire. We don't know what happened when allegations of misconduct, serious as they are, were brought to the attention of members of this particular government, aide minister, PCO, eventually PMO, and eventually the Prime Minister. And it seems that nothing has been done, and nobody is accountable for, obviously, a major act of omission. I mean, there was a lack of any action, corrective action, preventative action taken. And surely we need to know, as a nation, as an advanced democracy, as somebody, in fact, who is concerned with the rule of law and concerned with the reputation of our armed forces.
Are you?
And that troubles me.
Are you satisfied the PMO and the PCO and the Minister of Defence, based on where we are in the hunt for testimony and answers here, that they did everything they could have and should have to investigate the allegation back then and since then? an allegation that came with a few details and a complainant who at the time didn't want to be identified because she was worried about her career.
They haven't. I mean, they fail in their individual and collective duty. To begin with, the Minister of National Defence, I think he had a positive duty, if not to investigate, I think he had, and he had the power to do so, at the very least to ensure that the Prime Minister, his boss, was made aware of it, either through one of his staff or through the intervention of either PCO or PMO official, but ultimately, on a tete-a-tete or a phone call to the Prime Minister, I need to make you aware of, and then decide together as to what needs to be done. You couldn't just, ignore it and just let it be. And this is what happened at the moment. And it's concerning because you kind of wonder, is this the kind of thing that our senior leadership in the armed forces at the political levels are dealing with a crisis in leadership? And obviously, it certainly doesn't allow any one of us to have a sense of confidence into their capacity and willingness to exercise not only the powers, but the responsibility that they each have.
The Prime Minister and his ministers prefer to move forward in the narrative now, promising to do better at reforming the culture of the military in this country with another review, this one done by former Justice Louise Arbour. Do you support that approach?
No, I don't. I mean, anybody who commits such a major errors wants to move forward, wants to have no accountability, wants to ensure, in fact, you can clean the state clean and then allow them, in fact, to proceed. I think there are lessons to be learned. I don't think we can redo the past, but we certainly can learn from it, and we can certainly make sure there is accountability taking place. So if and when this occurs, not only with the CDS, but any other office holder at such a significant position, whether it be the head of the RCMP or CSIS or whatever, that there is, in fact, a process in place, regardless of what political affiliation it is, and whoever happens to be subject of allegation, that action is taken and is taken in a set way.
Right,
and at the moment,
but Justice Arbour, Justice Arbour, that's now apparently her mandate, is to look at an outside independent reporting process that the government did not put in place after Justice Deschamps' report 5 years ago. So, I mean, do you support the process to get us there, or do you think they're kicking the can down the road here?
No, I don't. I don't at all. Absolutely at all. There is sufficient knowledge and sufficient experience shared by our allies that provides us with an opportunity, in fact, to clean house and to make sure there is an external process put into place. I'm certainly alluding to the creation of Inspector General. We don't need another study to come up to that. Whether we call it an Inspector General or something else, it doesn't really matter. It's external and it's reporting to Parliament. Now, Madame Arbour will not look at the procedures used within PMO and PCO. Her task is to look at the Defense Department and to provide them with advice on an ongoing basis as to about the professional conduct and the sexual misconduct that is happening in the Defense Department. And most of our recommendations, if any, are going to be a repeat of what Madame Deschamps' excellent and comprehensive report was made in 2015. All the Defense Minister and the government is doing at the moment is trying to buy time and basically playing footsie with the Canadian public electorate and saying, trust us, maybe we'll forget, and maybe by the time the next election comes around, we will be able to turn the page. The 100,000 Canadian military who are currently serving in the forces expect better and more prudent leadership from both the military and the civilian leaders at what they're getting at the moment. Those of us who are retired, is about 200,000 veterans, are deprived of the pride that we have into the military service that us and our fathers and grandfathers have done, and expect much better management and leadership from both, again, the civilian and the military leadership that we're currently having.
Okay. All right. Michel Drapeau, good to talk to you tonight. Thanks for taking the time. We'll talk again.
Thank you.
And that is all the time we have for this edition of Primetime Politics. I'm Peter Van Dusen. From all of us here at CPAC, thanks for watching. We'll see you next time.